Okay, if I'm audible, then we are on time and we are going to start the session. Wonderful good evening to everyone. And it's a great marathon going on because since it is a second session, we had attended the first session also. Very good presenters and kudos to all the team who had organized very efficiently. And yes, because it is the first time and we are facing some issues, but these issues are simultaneously being resolved ASAP. So I congratulate all the organizers, team members. Moving on, I would like to invite our chairs. We are waiting for Dr. Bineet Dwivedi. He is also a moderator. I think he'll join in a while. By the time I'll invite the chairs. First of all, I would like to invite Dr. Bernardo. He is a Prime General Secretary of LMHI, USA, and he's a medical education and training. So, sir, I welcome you on the behalf of all the LMHI organizers, panelists, everybody. So, please join us. And our another chair, Dr. Lex Rutten, I'll introduce him. He is appointed officer in the Order of Orange Nassau by the former Queen of Netherlands in 2003. Coordinator of LMHI COVID-19 data collection team, produced a Bayesian mini repertoire for COVID-19 and corresponding app. I welcome you all. Welcome, Dr. Lux. And our third chair, Professor Shubhamoy Ghosh. He is MD Homeopath, MSc and BHMS. Dr. Subhoy Ghosh is working at the capacity of professor and head of the Department of Pathology and Microbiology and visiting physician of D&D Homeopathic Medical College and Hospital Government of West Bengal. A very warm welcome to all the chairs and our first speaker. Can we have our first speaker, please?
Hello. Yeah, I'm here, Dr. Renu.
Yeah, sure. Please, you are Dr. Milind Sen Gupta, right?
No, Dr. Kavita Kukunur. I got the slot at 9:30.
Oh, yeah. You have shifted that session. Okay, Dr. Kavita, you can go ahead, please.
Okay. Hello, everyone. So, greetings from USA and greetings to all the chairs. A warm welcome to all the chairs and the delegates. You want me to share my screen, please?
Yes, please.
Greetings from the USA. This is Kavita Kukunur, and I thank Universe for bringing us together in these unprecedented times. And on behalf of Ka Homeopathy Study Group, I thank LMHI 2021 Global Colloquium for honoring us this great opportunity to present our work. Acute and long COVID with homeopathy. Beginning as early 1825, when Dr. Samuel Hahnemann defined and established the genus Epidemicus. During the scarlet fever pandemic, many lives have been saved. And this study reviews recent and ongoing study research showing the positive results in the treatment of COVID-19 with homeopathy. And I will come to homeoprophylaxis little later under the CV NOSOD research. Coming to the epidemic curve, per World Health Organization, linking steepness of COVID-19 curve to more ICU requirements. As you see in this curve, where between 18 to 12, there is a steep. And I'm going to present today Ka Homeopathy Study Group results and the FHCA results. Through Ka Homeopathy Study Group, more than 2,000 cases have been treated worldwide. And the treatment was individualized based upon the classical homeopathic principles for acute and the constitutional prescribing. Today, we'll be presenting the data of Dr. Rajneesh Kumar Sharma, HomeoCure from India. A total of 132 patients took homeopathic treatment, and 79 males and 53 females. Out of these, 112 cured and 11 died from severity, and 9 were referred. Most infectious diseases were self-limiting, and they are categorized as 81% mild. Severe some needs the supplemental like 14%, and then critical required the ventilation 5%. And deaths were confirmed positive for the COVID-19, which you will see in these charts, both the male and the female. And coming to them, I'll discuss about the remedies little later. But coming to the case fatality rate, as per the WHO, overall CFR is 2.0 to 3.7%, and greater than 1% CFR in age above 50 years, and 10% CFR in age 80 years. So the case fatality rate is highest if there is coexisting disease conditions. And through the Dr. Rajneesh Kumar's research, as 112 cured and they have improved and their health got better overall at all levels. Coming to the FHCA, being a certified HP supervisor and being a part of FHCA led by Kate Birch, Free and Healthy Children International, we have conducted the research program, and CV nosur was used prophylactically as homeoprophylaxis and for the treatment of COVID-19 through our FHCA research program. And per the protocol of FHCA, the client were given single dose of CV1M with 2-week and 3-month follow-up. So it is this way, like they have received the CV1M single dose, then next week triple dose, and then the follow-up was done for the 2-week and the 3-month follow-up. You will see the chart ranges here. In chart 1.3, the age ranges of respondents who took the nosur from pregnant women, newborn to the 90s, and the number of at what age, how many have taken the nosur. And you will see the second chart 1.5b, number of doses reported. So how many took the single dose, 200 dose and triple dose? So majority of them were around 429 took the single dose 1M CV nosur and around 380 triple dose, 10M triple dose. So coming to this one, and when we see the research, around 434 in this chart, response in respondents with active disease. This is all real time with the real cases. So out of 434, 62 had the active disease and 60 got cured with the nosur. So coming to the discussion, more than 20 polycrest remedies. You see the repetization through Zomeo. All the rubrics were considered extensively, like for fever, dry cough, shortness of breath, tiredness, aches, pains, nasal congestion, throat inflammation, anosmia, sore throat, headache, diarrhea, to name few. And with the detailed repetization, we have come up with several remedies, which can be seen here under this detailed thing, from arsenicum to
Ma'am, please unmute yourself.
oh, sorry. So the remedies through the detailed repetization through Zomeo software, you can see many remedies. Even the repetization was done under different through radar software also. So we have come up with several remedies to name few, like arsenicum album, phosphorus, bryonia, chelidonium, camphora, lycopodium, antimas, to name few. So per FHCA protocol, as it is, it was 96.7% cure rate. As I was telling, like, and for 434 total number of cases, 62 got had the active disease and 60 got cured. So coming to the aphorism 253 of Organon. After the administration of the medicine acute disease, there is a change in the patient's disposition. There is calmness of mind is noted and overall health. So in conclusion, homeopathy helps for overall health as a prophylactically through homeoprophylaxis. And sincere acknowledgements to our Homeopathy Study Group Pro Bono, Dr. Rajneesh Kumar from India, MD Homeopathy, Dr. Sweta Singh and Ian Yamamoto, and FHCA team, Kate Birch and her team. So thank you so much to LMHI 2021 for giving us this great opportunity.
Thank you, Dr. Kavita. I think we must be very careful in drawing conclusions about effectiveness of homeopathy. Such data collections are especially useful to compare your findings with others. And I think it would be wise to join the other data collections with these data so that the different data collections can be compared, and especially that we can compare why we prescribed which medicine. So homeopathy will improve by this kind of data selection. Thank you.
Thank you so much, Dr. Alex. And the research links were given. It was published under the Similia, the FHCA Free and Healthy Children Research. It was extensively published. Thank you so much. And it was mentioned under the link in the poster. Thank you.
Okay.
Any other questions, please? Our chair, Dr. Bernardo and Dr. Shubhamaya, please. Any questions? So shall we move ahead for the next poster? Since this is a theme, epidemic and pandemic, experience of acute and long COVID, and the sub-theme is case reports, cohort studies on the COVID-19 treatment. And the Dr. Lux, he had himself developed the thing regarding that. So he's the best chair for this session. So I would like to invite our another speaker, Mr. Amit Arora. His topic is post-COVID-19 inappropriate sinus tachycardia treated with homeopathy, a case report. Mr. Amit Arora, are you ready?
Yeah. Hello, good evening. Am I audible?
Yeah, sir, sure. You go ahead.
Good evening, everyone. And first of all, thank you so much for giving me such a great opportunity on this global platform. So without taking more time, I would like to start with my presentation. Shall I share my screen?
Yes, sir.
Okay. Now, I am going to present a case report of post-COVID-19 inappropriate sinus tachycardia treated with homeopathy. So first of all, I would like to state what is actually an inappropriate sinus tachycardia. So it is a clinical condition which is characterized by persistently elevated heart rate that is greater than 100 beats per minute at rest without any evidence of significant heart disease or without any other etiological factors. So in order to diagnose an inappropriate sinus tachycardia, we all need to first of all exclude other causes of tachycardia like any kind of heart disease or other factors like fever, anemia, or you can say the hyperthyroidism cases or other cases like pericarditis, myocarditis. So all have to be first of all to be ruled out to diagnose the inappropriate sinus tachycardia. And it is little different from the sinus tachycardia because sinus tachycardia occurs in normal persons after some triggering factors, and then it becomes the heart rate becomes normal when that trigger factor is removed. But in case of inappropriate sinus tachycardia, the condition here, even at the rest, the heartbeats always remains elevated more than 100, or you can say at an average 90 beats per minute for the whole day. No specific cause is ascertained, but it is seen that viral infections can trigger this infection. After SARS-CoV-2, we have seen a lot of reports where the patients are coming back with the cardiovascular manifestations after recovery. And findings suggest that tachycardia, palpitation, fatigue are the frequently reported complaints in post-COVID-19 syndrome. And when the persons coming up with the tachycardia have no obvious cause for this, those cases may be clinically diagnosed as post-COVID-19 inappropriate sinus tachycardia. The common diagnostic criteria is electrocardiography, where the ECG shows normal sinus rhythm with rapid heart rate and no premature atrial or ventricular complexity. Definitely, it is a diagnosis of exclusion, so other causes of tachycardia need to be ruled out. So hereby I am showing you a case of a male, 28-year-old male, who presented in our OPD with the complaint of fast heartbeats with distressing palpitations just after the recovery from the COVID-19. He suffered from the mild COVID-19. He developed symptoms for 3 to 4 days and was well treated at home only. But after that, he developed the episodes of palpitation and fast heartbeats, that is tachycardia. The pulse rate used to be remain above 100 per minute, and sometimes it used to overshoot to 120 to even 140 during any kind, even during the sleep. The palpitations were distressing for him, and they used to get exaggerated by the activity. And along with that, there was another symptom, that was fatigue on exertion. The examination was done to rule out the causes like any kind of heart disease. So pulse was 124 beats per minute, which was regular. SpO2 level 98%, BP was normal. All the respiratory and cardiovascular system, nothing abnormality detected, and lab findings showed the normal result for CBC, LFT, CRP, chest X-ray, echo, all were normal. Only the ECG revealed the heart rate elevated, that was 133 beats per minute with the normal sinus rate. So here you can see one report I have shown, like this is the echo report, because main aim was to rule out any kind of pathological aspect of the heart. So echo report showed the heart is normal in its physiology. Now, the symptoms were very few in this case. No significant characteristic symptoms were detected. So we took just the specific symptoms for the complaint, like palpitations. We repertorized the case with a complete repertory and took some symptoms like palpitations of the heart, motion aggravate, rapid tachycardia, regular, and weakness from exertion. And after repertorization, the only remedy which covered all the symptoms was nausea. In general, I was not aware so much about the nausea, so I went through the source material medica. And in the TFLN encyclopedia, I found palpitation of the heart, pulse 120, regular in rhythm, unusual beating of heart. Kent Materia Medica says palpitation after exertion of any kind, most useful of all remedies we have in cardiac state with very few symptoms. And another TFLN therapeutic says that the palpitation for years without any obvious cause. So after going through three sources, I prescribed Naja 30, that is in low potency. Repeatedly, doses were given 3 times a day, and within 10 days, the first result we found that the episodes of palpitations were decreased. So that was our indication that our remedy is somewhere right. And after 2 follow-ups or 2 to 3 follow-ups, when the case became static, the heart rate was continuously going on with the 100. Naja T was prescribed in higher potency, that is 200 in unit doses. And gradually the patient started recovering. With the ECG graphs, you can see this was the ECG at the first visit, which showed the heart rate 133 with the normal sinus rhythm, regular sinus rhythm, and no premature complexity. The second ECG was advised when the heart rate came out to be 95 beats per minute with regular sinus rhythm, normal PQRST. And the last ECG at the 7th follow-up, when it was done, it came out to be a normal heart rate, that was 82 beats. The patient was also followed after that because he used to came for the routine ailments, and still he is coming up for routine ailments like cough and cold if sometime happen. And every time when we check him, his pulse, it comes out to be 80 to 85 in the normal limits. So this single case report where the post-COVID inappropriate sinus tachycardia was treated with the homeopathic remedy alone. And this case highlights the effectiveness of this great remedy in conditions where tachycardia and palpitations are really common in post-COVID scenario. So I think additional clinical researches in this direction and utilization of this remedy will lead to, or will give us a wider scope for the post-COVID inappropriate sinus tachycardia or post-COVID tachycardias and palpitations. So this is all I conclude, and thank you so much to the LMHI for giving me such a great opportunity to present my single case on post-COVID inappropriate sinus tachycardia. Over to
Thank you, Dr. Amit.
Thank you, sir.
Most interesting because when this post-COVID tachycardia is frequently seen, we need such medicines, and they are not yet frequently prescribed for COVID as yet. So I suggest that such cases will be recorded somewhere to be compared with other cases to see how much we can have from this medicine. Thank you very much.
Thank you so much, sir. Thank you.
Thank you, Dr. Amit. Any questions? So I think shall we go ahead?
Thank you so
Uh,
much.
Thank you, sir.
So
So
I
our,
think next presenter is Dr. Poonama Rani. She is
yeah,
going to
Dr.
present case report on homeopathic treatment of a case of post-COVID mucormycosis. So I think now, please come Dr. Poonama Rani to present their work.
Yes, sir. Very warm greetings to all of you. Shall I start by sharing my screen?
Yeah, please
Yes.
share your screen.
Okay. Is my screen visible?
Yes, yes, go ahead.
Okay, so let me introduce myself. I'm Dr. Poonima Rani, Research Associate in Directorate of Ayush, and I'm posted at GTP Hospital, Delhi, India. So today I'm going to present a case of post-COVID mucormycosis, which I, along with my senior medical officer, Dr. Momita Chakravarti, treated with homeopathic medicine and found the favorable outcome. So I'm sharing my case with you. The main aim to undertake the case was to improve the condition of the patient symptomatically and prevent disability by slowing down the spread of the disease. As we all know, it is a very deadly disease, and it is very important to slow down the spread of the disease, as it can reach to brain and cause so many complications. So now let me introduce to the mucormycosis. So mucormycosis was considered rare in India until this year. The cases rose dramatically in 2020 after the spread of COVID-19. Doctors across 16 hospitals that were part of a research network called the MucoCovid Network, which looked into mucormycosis and COVID-19, conducted a study in November and December. They conducted a study in 2019 as well as in 2020. They found that mucormycosis cases had doubled compared to the same period in 2019. Because of the COVID, the cases of mucormycosis has risen. According to a report in BBC News, around 45,374 cases were reported till July 2021, and more than 4,300 death cases were registered. So now you can see that how deadly this disease is and how rapidly it is progressing. So the main presenting type of mucormycosis in India was the ROCM, that is the rhino-orbito-cerebral mucormycosis. It is of great concern as it can have devastating implication on patient survival. However, the outcome can be optimized by early diagnosis and prompt treatment. Now let's talk about the patient's information. A 45-year-old male was admitted in GTB hospital in May 2021. He was presented with pain and swelling on the right side of the face, along with the watering from the eyes, headache, toothache, and there was a marked symptom that there was loosening of teeth. And he was experiencing all these symptoms since 5 days. And then he came to GTB hospital and he was admitted in the IPD. And there he was diagnosed as case of mucormycosis, as his KOH was positive and his MRI brain and CT-PNS were suggestive of fungal sinusitis. Also, after receiving the conventional treatment of liposomal amphotericin B injection, he experienced some other symptoms also, that was nausea, dyspepsia, weakness. So that was a part of conventional treatment. And now coming to the history part. Okay, now the history part. Can you see? Coming to the history part, he told that he was infected with COVID-19 in mid of April 2021 and he gradually recovered from it. He received oxygen and steroid therapy for the same, due to which he later on developed steroid-induced diabetes mellitus, which is also a contributing factor for development of mucormycosis. Now, on further inquiry from homeopathic point of view, he was found to be thirsty, his stools were unsatisfactory, urine frequency was increased, and there was increased perspiration, and thermally he was hot. Rest all the physical journals were within the normal limits. So I didn't mention in the poster. Me and my team visited patient twice daily, and it was observed that in spite of weakness, whenever we visited the patient, he stood up immediately and he performed his daily activities in a very hurried manner. So it was noticed that every time we visited him, he does things in a great hurry, like showing all his reports and telling all his complaints. So hurriedness was there in all his activities. Now coming to the treatment part, we, along with the multidisciplinary team of GTB Hospital, which consisted of specialists from different concerned departments like ENT surgeon, ophthalmologist, neurosurgeon, radiology, etc., we together treated the patient and attended the patient. And on conventional treatment, he was given injection of amphotericin B with posaconazole to control the fungal infection, and Pantop, that is the antacid, was given to control the side effects of amphotericin B. It was nausea, vomiting. Then homeopathic medicine was given as an adjuvant therapy after getting permission from the higher authorities. Totality of symptoms or the totality of symptoms indicated that Marxol was the remedy according to the symptom similarity, and it was administered in 30th potency. Medicines were changed subsequently as per the condition of the patients. Okay. Now we'd like to discuss the totality of symptoms on which Marxol was prescribed. First one was there is hastiness at the mental level, increased salivation, increased thirst, unsatisfactory stools, pain and swelling on the face, right-sided affection, toothache, loosening of teeth. Now, the patient started to improve gradually within 10 days of initiation of homeopathic treatment, with first disappearance of teeth complaints and gradually others. Teeth complaints that were toothache and loosening of teeth. So the toothache disappeared first, and then to our surprise, loosening of teeth also got subsided at the end of the hospital stay, and this was mentioned by the patient himself. It was noticed that patient was improved both mentally as well as physically with homeopathic medicine. Initially, he was followed up daily by our visit to the IPD for 15 days, and then for every week for 1 month, and thereafter he was discharged from the hospital, but we kept in touch with him and his family telephonically till now. We call the patient every 15 days to ask about his condition and tell him and his family to collect the medicine according to the situation. So the patient is still with us. In this case report, it is clearly evident that prompt homeopathic treatment along with conventional treatment helped patient of mucormycosis to recover quickly, where the patient only required FESS and not any other major surgeries like mandibulectomy, orbital exenteration, partial or complete maxillectomy, etc. These surgeries, where there is removal of eye, removal of mandible, maxilla, made deformities on the face. Even patients were unable to chew, unable to speak, and were drastically affected at the mental level. So this was the case, and I would like to appreciate the action of homeopathy, which helped the patient to arrest the disease at the early stage, so that he couldn't go up to the level that he might gone to surgeries which will made him worse. So lastly, I would like to mention that I'm very grateful and thankful to Dr. Manchanda sir for his to present this poster, and my senior Dr. Momita Chakravarti for her invaluable time, efforts and support to get permission to get access to the IPD patients and to prepare this poster presentation. Thank you all for your time and patient listening. Thank you.
Thank you, Dr. Purnima. The case is well described, and what I'm not sure about if and which medicine, homeopathic medicine, really worked. but that's not always possible to say. Anyway, I think some effort should be made to describe the reactions to the medicine and why you think that the medicine worked. For instance, was there repetition necessary? Did the improvement start at the first hours? Were there other reasons that could have improved the patients? So that is always things that have to be in case descriptions, but well, the room you have in such a presentation is not so big. Thank you anyway.
Okay, thank you. Thank you so much, sir.
Thank you, Dr. Purnima. There is a question in our chat box. I'll read it for you.
Okay,
The
ma'am.
question is from Todd Hoover. He's asking, does the speaker feel the mucormycosis is due to the infection by COVID-19 or due to treatments such as IV steroids commonly used as therapy for COVID-19?
I think all are the contributing factors that having COVID infection, and then he was treated with steroid also. So we cannot say that directly COVID was responsible or the use of steroid was responsible. And also he got diabetes mellitus also after getting steroids. So we are not sure about the cause, whether it was COVID or steroid.
Dr. Toad, are you there, Dr. Toad? So I think she has, thank you, Dr. Purnima, for answering the question very well. And we'll move ahead on the next speaker. We have our next speaker, Dr. P.P. Sheila Joyce from India. She is going to present the case report on the topic effective of Mancinella in post-COVID-19 alopecia. So I request Dr. P.P. Sheila to share the screen, and Dr. Purnima, you can exit this screen, please, so that she can join. Dr. P.P. Sheila, are you there?
Yeah, I'm there. Good evening.
Yeah, okay. Share your screen, please.
Yeah.
While she is sharing her screen, Dr. Toad has asked another one question from Dr. Purnima. Dr. Purnima, are you there? Dr. Purnima? I think she left. So, Dr. Sheila, you can share.
Yeah, good evening. Is my screen visible?
Yeah. You make it quite zoom. It is very.
Is it okay now?
Yes.
Yes.
Yeah. Once again, good evening, one and all. First of all, I would like to thank LMHI for giving me this opportunity to present this very, very simple, small study which we have experienced in a clinic. This is actually not a research study. This is just a sharing of my experience which we underwent in our clinic practice. And further vast research is being proceeded after that. So this is just a pilot version of that. So the title of my study is Effectiveness of Mancinella in Post-COVID-19 Alopecia. Okay. So to introduce about the study, all of us are aware that hair loss related disorders has been a common concern during this COVID era. During this COVID outbreak, most of the clinicians and the public were facing undergoing lot of problems because of this hair loss. So we decided to share a simple experience which we could achieve with the help of Mancinella 200. Which was not done by very scientifically, not taken up for a thing, just by the reference of Boric and Patek repertory, we have prescribed this. So hair loss is a common emotionally distressing disease And in all genders, it is an emotional distressing disorder. The cause may be different causes, that is maybe psychological stress, systemic inflammation, oxidative stress, or fever, or any other illness can also force more of hair into the shedding stage. So in this hair shedding stage, as we said, there are 3 stages for hair growth cycle. One is that is anagen, and then the catagen, and then the telogen. So in this anagen stage, there are that is a growth stage, and whereas a catagen stage is a transitional period, and this telogen phase is called the shedding phase. In generally, if you see in a normal human being cycle, the shedding phase is a normal phase where during the shedding phase, normally around 25 to 100 hairs can shed per day for a subject or for a normal individual. So when it goes exceed that, and even the patient may not be able to identify he has a hair fall. When it keeps on shedding and when there is a lot of thinning of hair only, the subject comes to an identification that he has lot of hair loss. So the objective here in my study is to study the effectiveness of Manzanilla in post-COVID-19 alopecia and to compare the effectiveness of thallium with Manzanilla in this post-COVID alopecia. So I've taken this. Yeah. This study was conducted in 60 subjects where we randomly prescribed Manzanilla and thallium 200 for this, that is randomly prescribed for 30 subjects. Depending upon the case study, we have taken a brief history of case with some prescribed questionnaire. And then what we did is, after taking the case, and depending upon the hair loss and the hair growth, we have developed a validated questionnaire which has been described by McDonald, Hull, and Norris. So similar pattern of questionnaire was developed and it was validated. And with the help of this questionnaire, we have taken up the progression of our study. So we prescribed Manzanilla and thallium for 4 days a month of duration of 2 months. So generally, if you see normal hair growth cycle, normally after the shedding phase by 6 months, there will be normal hair growth as a normal case. But here, since after these patients were affected by COVID-19, and later, even after 6 months, they were having severe hair loss, they have come into the clinic. And so, depending upon the case, we have just prescribed this by the repertorization, and that is a Patek's repertory. It says that in a Manzanilla, that is hair fall after an acute sickness is a repertorization for Manzanilla, and then alopecia following acute and exhausting, that is for thallium, and another one is carbovage. This is the 3 remedies which have been given in the repertory for hair loss after acute illness. So when we took a brief case of the study, we could find out it doesn't suit with carbovage, and so we thought of giving Manzanilla and thallium randomly to the subject. And when we saw the result, the scale used is just a photographic assessment to measure the change in the hair growth. And with our prepared questionnaire, the scores were of for 6 scores, and we have descriptions of different questions, and we have given the percentage for the effect of Manzanilla and effect of thallium. So you can see here the different descriptions where after prescription, how was the stage, that is whether it has gone worse or there was no change, or there was a mild change or moderate change or good or excellent. So when we could see that the person who have got Manzanilla, there was no any worsening condition, but in case of thallium, there's 10% of subjects, the case was worsening. And in case of changes, no change, In Manzanilla, 20% of the patient, there was no change. And in thallium, 50% of patient did not have any change. Then we could say mild change in 30% of cases who have taken Manzanilla and 35% who have taken thallium. Then a moderate change was there for 15% in case of Manzanilla and just 5% in case of thallium. And we got a good result of 25% in Manzanilla, and there was no good result received from thallium. And we had an excellent result. That is a very good hair growth was there in 10% of the subject with the help of Manzanilla, and there was no any excellent result we could not find because of thallium. So we observed in the study 80% of improvement according to the patient's own assessment, and also we tried with pull test. So we could find out it has a good improvement. And this photographic evidence and score obtained are by the different questionnaire was statistically significant when comparing the thallium 200 with Manzanilla 200 in this post-COVID alopecia. So we could find out that Manzanilla was more effective, and the grade of hair growth after taking Manzanilla 200, we got a highly positive result in this post-COVID individuals. So to conclude,
Dr. P.P. Sila, I think your time is over now.
Yes.
So finish as soon as possible.
Yeah, so to conclude this, Manzanilla can be considered as a best drug of choice for post-COVID alopecia. And this is not a final study. Further studies are still going on scientifically to prove it with better parameters involved. Thank you. Thank you for this opportunity.
Thank you, Dr. P.P. I think you have to be careful with such conclusions. Apparently, this is a comparative prospective study. And did you compare with placebo?
No, so that is what no control was there for this study. So we have we are doing a further study with larger group and a control group. Here there was no control group.
I think that is essential because we can think of many more medicines and also some statistical analysis if this could be due to chance. I think you must be careful to state that Manzanilla is the medicine for alopecia. This would be too soon to draw such a conclusion. Thank you.
Thank you, sir.
So thank you, Dr. Sila, for your wonderful presentation.
Thank you, sir.
Okay. Now, I think you felt good. So I can invite new speaker.
Yes, sir. I'll stop sharing.
Okay. So now next speaker is Dr. Priya Singh. She will present useful of homeopathy in medicine in COVID-19 associated mucormyosis, a scoping review. So may I request Dr. Priya Singh to kindly present her work. Dr. Priya Singh.
Namaskar and a very good evening to all the panelists and the attendees. Myself, Dr. Priya from Baxter Homeopathic Medical College. I'm an assistant professor in the Department of Homeopathic Pharmacy. My study is a very basic small-scale study on the usefulness of homeopathy in COVID-19 associated mucormycosis, and it is a scoping review. So to begin with, the term mucormycosis, commonly known as black fungus, is a common name given to the diseases caused by fungi of the order Mucorales. And it is basically a very highly invasive opportunistic fungal infection, having a high progressive rate and a high mortality rate. And in post-COVID cases, the rhino-orbitocerebral mucormycosis is the most common presentation, with the symptoms of eye and facial pain, numbness, followed by conjunctival suffusion, blurry visions, periorbital edema, and proptosis. Now, talking about the data till March 2021, 41 cases of COVID-associated mucormycosis had been reported around the world, with 70% in India. And by the June of this year, the figures were 11,700 cases in India as per the Lancet. Even before the pandemic, the zygomycosis is already far more common in India than any other country. It is an estimated, it affects estimated population of 14 per lakh people in India as compared to 0.06 per lakh in Australia. So the rationale of this review was to systematically map the research done in this area, as well as to identify the existing gaps in the knowledge regarding mucormycosis in the field of homeopathy, based on which the following research questions were formulated. What is known from homeopathic literature about the treatment of mucormycosis? And are there any published research work to establish antifungal effects of homeopathic drugs in vitro? And the objective was to study, identify and summarize the scientific evidence for homeopathic medicines in post-COVID mucormycosis. The methodology, it was a scoping review conducted following the PRISMA extension for scoping review guidelines 2018. A web-based literature search from databases, journals, and bibliographic resources was carried out till September 2021. In addition, freewheeling searches of the government website was done to retrieve the available information. And for antifungal effects, in vitro research studies on fungus causing infections in human beings was included. Plant fungus studies were excluded from the review. The individual case reports and those studies available in only abstract form were excluded. Now, coming to the results, total 2 review articles, primarily the first one by Javed D. et al. To investigate the role of therapeutic potential in Ayurveda and homeopathy on a review of published case reports of COVID-19 associated mucormycosis, published in the year 2021, was available, which detailed homeopathic medicines after repertorizing the clinical symptoms of mucormycosis. And the other one, a literature review by Mandeep Singh to study mucormycosis and its homeopathic approach, was found, published again in the year 2021. A document on information for homeopathic practitioners for management of diagnosed cases of mucormycosis, released by Ministry of Ayush, was available, and in all, 9 in vitro studies on antifungal effects of homeopathic medicines were found. So the studies have been mentioned in the reference for your pursuit. Then the available literature to establish the role of homeopathy is actually limited to a few studies only. Several homeopathic medicines, they have been studied for their in vitro antifungal effects. So as you can see in the figure 1 here, maximum studies have been done on Candida albicans in all 5, with the published work of antifungal effects of almost 26 homeopathic drugs, and followed by 1 study each on the other species. However, no specific study on mucorales was found, though these studies, they provide substantial evidence and they can form the basis of clinical use of homeopathic medicines in fungal infections. In all, 48 drugs have been identified from both the review works and in vitro studies in homeopathy. So in the figure number 2 over here, I hope you can relate. The medicines, they have been grouped for a quick reference. The common homeopathic drugs likely possible to have both antifungal effects and they can be used symptomatically in mucormycosis are the center ones, the acid benzoicum, kali iodatum, Merck solubilis, phosphorus, sulfa iodatum, thuja occidentalis. So the conclusion which I came to after the scoping review was that the role of homeopathy in mucormycosis has not been much explored. So to bridge the gap in knowledge, well-conducted observational trials and clinical studies are needed. And the scoping review may form an excellent foundation to draw the attention of scientists and researchers throughout the globe to study and understand the role of homeopathic medicines in the treatment of mucormycosis and such opportunistic fungal infections. And following these suggestions, research conducted may determine the importance and value of homeopathy in mucormycosis and a possible scope for a systematic review. That's all. Please, I would like to welcome the questions.
Thank you, Dr. Priya. Is mucormycosis still a problem in India?
Sir, yes, but very few cases are being reported, though it is an opportunistic fungal infection, which is mostly seen in the immunocompromised patients and the patients having hyperglycemia. So yes, it is generally also available, yes, but post-COVID cases have gone down.
Yeah, but I guess it will not be easy to conduct a proper study on
yes, sir, I completely
homeopathy.
agree with you. Yes, sir, because the cases it is such a rapid progressive disease, causing so much, very rapidly progressing, causing even reaching the brain. So yes, I'm sure that it will be difficult.
Yeah, okay. Well, thank you. I agree with your conclusion, and it could be a start for further studies.
Thank you so much.
Thank you, Dr. Priya. There is a suggestion for Dr. Sheila earlier who presented that better to state that Mencilina appears better than thallium in the application. More research needed. So I request Dr. Sheila to modify her poster for the final presentation on the 12th. I guess she might have listening this. So thank you, Dr. Priya. Dr.
Thank you so
Vineet,
much,
if you
ma'am.
can
Thank you all for giving me this platform. Have a wonderful night.
Thank you. Dr. Vineet, you can invite another speaker. There is a question for Dr. Priya itself. If no studies have been done on mycorrhizal species, how then is the data in your chart relevant to mucormycosis disease treatment?
I would like to answer this question as yes, no, as such observational or clinical trials are missing. Only literature review is available, and I have tried to correlate that with the antifungal studies that have happened. So I've just tried to form a conclusive group of medicines which can be employed in such cases. And obviously, scoping review is basically to find out the possible available literature. So that is why it was just a basic attempt.
Thank you, Dr. Priya, for answering the question.
I hope the answer is satisfactory. Thank you so much.
Yeah, we hope.
Thank you, Dr. Priya. Now I think I invite Dr. Milan Sen Gupta. He's going to present a possible role of environmental arsenic against SARS-CoV-2. So I think the topic is for prevention of COVID-19. So I will invite Dr. Milan Sen Gupta to present their work.
Hello.
Oh, hello.
Am I audible? Am I audible?
Yeah.
Yes,
Hello?
sir, you are good.
Am I audible?
Yes, sir, you go ahead.
Your voice.
Okay.
Yeah.
Okay. The screen is clear. The screen is clear.
I think
Is the screen
screen is a little bit short. You can zoom it so that it can be easily readable.
Okay.
Little more, please.
Is it clear? Is it clear?
Quite clear. If you can zoom in more.
You can zoom more.
Okay.
Yes.
Yes. Good evening, everybody, especially the panelists and dignitaries, those who are present here. Myself, Dr. Milan Sengupta, faculty, DNB Homeopathic Medical College and Hospital, Government of West Bengal, Kolkata. My topic is a possible role of environmental arsenic against SARS-CoV-2. Before 20th century, arsenic compounds were the first drug of choice in most of the disease. And now it is used only for important diseases, practically acute promyelocytic leukemia, hepatocellular carcinoma, autoimmune disease, and African trypanosomiasis. In this study, we first observed much less COVID-19 cases in some arsenic-rich groundwater areas in West Bengal. Then we aim to find out whether negative correlation between the groundwater arsenic level and COVID-19 incidence is present in different parts of the world. We presume that in developed countries, it is very difficult to find out that whether the level of arsenic is present. It is very difficult to find out. And not only that, in some other countries, especially the developed countries, they treated those arsenic water. So naturally, though there is a in groundwater, the arsenic level is high, but that is not much high level in some areas. It will not influence the human being due to that policed modern water supply system. Even then, after analysis, we become totally convinced that there is a definite relationship, and in areas where groundwater arsenic level are high, COVID-19 incidence is much less. In many countries, it is lowest compared to all other areas of those countries. This finding may be an incidental one. However, we must look detail into it. Long ago, 1883, I.L. Procure specified that arsenic was the #1 remedy which he used in practice. And long before that, Hippocrates used orpiment and regular, two arsenic compounds to treat the ulcer. Arsenic was also used to treat as an antiseptic. Powder solution, which was used in US till 1950 to diminish the fever. Not only that, in China, arsenic, tuberculosis and parasitic disease was treated by arsenic, and Salvarsan 606 also used to treat the syphilis. Apart from this, arsenic compounds are also used in different purpose. However, arsenic was used for poisoning, and arsenic compound shows the teratogenic action in chick embryo, mice, rat, and hamsters. They also show mutagenic action in Allium cepa in human leukocytes and are known carcinogens. Thus gradually, the use of arsenic as a remedy was discontinued with the advent of modern science. However, even today, arsenic compounds are used in some disease, especially in promyelocytic leukemia. Arsenic trioxide is now the drug of choice. Apart from this, this is also used in or highly effective in autoimmune disease like that of the multiple sclerosis, lupus, erythematosus, and diabetes mellitus, and also hepatocellular carcinoma, as well as graft versus host disease. It may be admitted that to find out a relation between the groundwater arsenic and incidence of COVID-19 cases is extremely difficult. This is because in most developed countries, there practically no chance of arsenic contamination in drinking water. However, when we collected data of groundwater arsenic level and tried to find out a negative correlation between the groundwater arsenic level and COVID-19 incidence, we established that this relationship is present in most part of the world. Our observations in Minas Gerais, Brazil, number of COVID-19 cases is minimum throughout the country, and these areas groundwater arsenic level is very high. Ghazni, Afghanistan, most arsenic affluent area. COVID-19 cases are minimum in that area compared to the other areas. Victoria, arsenic level is mildly increased, and COVID-19 cases are much less in New South Wales. And not only that, Bangladesh, our neighbor country, is very high groundwater arsenic is there, but the COVID-19 cases are much less throughout the country. Not only that, in Cambodia, Prey Vang Delta area, where the arsenic level is very high and groundwater COVID-19 cases much less. In Canada, in British Columbia, similarly in India and China, number of COVID-19 cases is much less in arsenic-rich area compared to the other areas. Apart from this, Finland, Japan, and some parts of the United States, in some area, it has been observed that the groundwater arsenic level is high and COVID-19 cases is low. Nepal is also an arsenic-prone area like Bangladesh, and West Bengal and Rupandehi of Nepal contains a large amount of arsenic COVID-19 cases. In Nepal are still much less. In Pakistan and Taiwan, the arsenic-prone areas, COVID-19 cases are less. Arsenic that our arsenic prepared from this arsenic trioxide not only rapidly absorbed through the intestine, but it can also easily absorb through the lung and skin. In blood, they easily bind to RBCs. Arsenic trioxide react with cysteine and modulate protein kinase C in FKB, mitogen activated protein kinase. Arsenic trioxide can modulate the cytokines, interferons, and autoantibodies, and arsenic compounds can cause immunosuppression without affecting the components of immune system. Although Huang et al., this is a preprint publications, but I think now it is published, mentioned possibility of arsenic trioxide as the inhibitor of ACE2 receptor, but they do not elucidate it. The role of nicotine in modulating the ACE2 receptor is known, and although still controversial, it has already been reported that cigarette smoking may prevent the COVID-19. However, cigarette smoking also contain arsenic. Thus, the role of arsenic may also be present in this aspect. Pulmonary exposure of arsenic is about 10 mg per day in smokers,
while in non-smokers, it is 1 milligram per day. Again, arsenic and phosphorus are both group 15 elements, and enzymes producing phosphate esters can also participate formation of arsenate esters. Arsenosugars and arsenolipids are also well known, and arsenic can remarkably diminish rRNA, leading to death phase of an organism. It has also been suggested that arsenic may replace the phosphorus for many biological functions. It may analyze all these biological activities. Then this also indicates that the arsenic should have a role against COVID-19. Again, we go back to 1900 in England and Wales. There was epidemic of arsenic poisoning, which was commonly known as English beer poisoning. And if we look into the epidemic of influenza from 1847 to 1890, there were few cases, but in between 1890 to 1900, there were 3 epidemics, which decreased abruptly in 1900, indicating possible link of arsenic poisoning and decline of influenza. Thus, considering all these features, we must conclude that a possible role of arsenic trioxide may be there to prevent and or mitigate COVID-19 cases. All of you know that our Ayush Department of Ayush suggests these arsenic album for preventing the COVID-19 and also mitigate the COVID-19 symptoms. It is our utmost request to all scientists of the globe to look into this matter for the benefit of tormented humanity. But here it is important things to note that the analysis should be done in area-wise in a country. Country-wise data analysis will not show a statistically significant correlation between arsenic level and the COVID-19 incidence. This is arsenic level and COVID-19. The arsenic levels and COVID-19 incidence in the world. This is the most important part of our presentation. We know that arsenic, which is prepared from the arsenic trioxide, produces significant reactive oxygen species through the mitochondrial electron transport chain. Activation of NADPH also contribute to the generation of superoxide anion. And additionally, arsenic metabolism leads to generation of reactive oxygen species in cells. The role of reactive oxygen species participating in antiviral host defense.
Dr. Milan, I think your time is over. Please conclude as soon as possible.
Okay. So this ROS can this ROS mediated this ROS particular reactive oxygen species assumed to be mediated by the apoptosis, which is a programmed cell death. So increased ROS level thus on process and programmed cell death occur in this way. And finally, the infected and eliminated, thus blocking the spreading of the viral infections. So it is our proposed model regarding the immunomodulation of arsenic in SARS-CoV-2 cases. Thank you all.
Thank you, Dr. Milan. This is certainly interesting, but we must realize that lots of variables have been proposed to influence COVID-19. As you yourself suggest, lots of research has to be done. And it is still unclear to me in what respect this influences homeopathy.
Yes, sir. Yes, sir.
Thanks to Dr. Milan for representing wonderful use of arsenic in different countries like Bangladesh and other countries, and other form like arsenic trioxide. I think arsenic is a wonderful chemical compound which can be further used in homeopathy for the treatment of epidemic, not also in corona in wave 1 and wave 2. So thank you, Dr. Milan, for your
lots of investigation is required, sir.
Yeah. So good. I think you can carry on your work.
Thank you.
So with this, I conclude, and I think now I call next speaker.
Okay. So another speaker is Dr. Rekha Thomas. Her topic is usage of arsenic album 13 COVID-19 frontline healthcare workers in government hospital Delhi, India, a case report. So another arsenic album 30. So I would request Dr. Rekha, please join and share her screen.
Okay. So thank you for the introduction. The theme of my presentation is the usage of arsenic album in COVID-19 frontline healthcare workers, HCW, in Government Hospital, Delhi, India. So, first of all, I would like to brief you regarding the background and rationale behind the study. The institution to which I am affiliated, that is Nehru Homeopathic Medical College and Hospital, New Delhi, India, was designated as a COVID health center in April 2020. Later on, a COVID testing center was also functional from the month of July. So when the hospital was converted to COVID health center, doctors, nursing staff, nursing orderlies, sanitation staff, and security staff were posted. And at our CTC, our lab technicians were involved in the high-risk task of collecting samples for conducting RAT and RT-PCR test. So it was our prime responsibility to keep our main task force, that is the frontline healthcare workers, healthy and free from COVID. And during that period, COVID vaccinations were also not available in India. So limited evidence exists about the efficacy of homeopathic medicine as prophylaxis in COVID healthcare workers. The advisory by CCRH and Ayush Ministry were considered, and it was decided to use homeopathic prophylaxis on our healthcare workers. Now I will enlarge the screen. Coming to the materials and methods, in this study, the frontline healthcare workers at COVID Healthcare Center and the COVID Testing Center at NHMC and H Delhi, India, during May to August 2020 were analyzed. HCWs, a total of 100, were divided into two groups, N1 and N2, and they were assigned duties for 7 days or 14 days, and they were grouped accordingly on the basis of receiving arsenic album 30 for 7 days. That is, the 38 participants received arsenic alb for 7 days and 62 received for 14 days. At baseline, that means on day 1 of the study, risk categorization of the participants was done on the basis of WHO 2019 COVID Healthcare Worker Risker Categorization. And at the end of their duty period, the participants, they underwent COVID-19 test, RAT or RT-PCR, and or when they developed symptoms. Results of COVID-19 test and symptom incidence were the primary outcome measures. COVID-19 symptomatology and symptom resolution were analyzed as secondary outcomes. Additionally, after the duty period, symptom incidents were analyzed at 1 month and after 3 months of the duty. Now coming to the result section, the study found that among the enrolled HCWs, median age was 35. And you can see this table. Of this, you can see that 89% of the HCWs were at high risk for COVID-19 infection. 98% HCWs reported negative. This you can see in the table too, 98% reported negative COVID-19 test. No COVID-like symptoms were observed in the 14-day prophylaxis group. In the 7-day prophylaxis group, 4 HCWs developed COVID-like symptoms. And among the 4, 2 tested positive. And they recovered within 10 days with no complications as shown in this table. The common symptoms were fever, then body ache, shortness of breath, and weakness. It is very noteworthy to mention that COVID-19-like symptoms were not observed in any HCW at 1 month and 3-month follow-up. Now, I would like to summarize the findings of our study. That is, the healthcare workers, N is equal to 100, received 30 arsenic alb 30 daily dose prophylaxis, and on day 1 of the duty, they were asymptomatic. 38% of the participants received arsenic alb for 7 days, whereas 62% received arsenic alb for 14 days. COVID symptom screening was done for all the participants, and it was found that 96% of the HCWs were asymptomatic, whereas 4% developed symptoms. Then COVID testing was done and 96 were tested negative. Out of the 4 symptomatic, 2 developed symptoms and they recovered within a short time, as well as those out of the 4, the 2 tested positive and they recovered within 10 days with no complications. So the study concludes that a positive role of arsenic album 30 can be seen in frontline healthcare workers for COVID-19 prophylaxis. I would like to thank my co-authors for their support and participation in the study. Thank you all for patient listening.
Thank you, Dr. Rekha. Questions, please.
I must say I couldn't hear a word of it, and the presentation was rather small, so I'm not sure what to think of it. My first reaction would be that numbers are too small to draw conclusions.
Yes, sir. That's right, sir. That's right. That's right, sir. This was actually an observational study, sir, using a small population of healthcare workers.
You are hardly audible. It is.
Sir, a small population was involved in this. A population of only 100 healthcare workers were involved in the study.
Okay, well, it's pity. I cannot hear anything, so it's hard to for the discussion.
Yes, sir. Actually, her voice was very low. So, what we all can see is from the poster only. So, shall we move ahead? Dr.
I think
Thank you,
we
Dr.
can call.
Rekha.
Yeah, thank you.
Now I call Dr. Himanshu Shekhar Tiwari to present his work. The topic of Himanshu Shekhar is Hahnemann's position on vaccination, a comprehensive literature review on a call to rethink. So I would like to call Dr. Himanshu Shekhar Tiwari to present his work.
Thank you, Team LMHI, for having me here. Is my screen is visible to all of you?
Your screen is visible, but you have to enlarge because size is very small. It cannot be readable. So you can enlarge.
My topic is Hahnemann's position on vaccination, a comprehensive literature review, and a call to rethink. In the current time of COVID pandemic and perhaps the largest vaccination drive that is known to mankind, clarity on Hahnemann's position on vaccination is more important than ever for homeopaths. Until now, the debate on whether Hahnemann was in favor of vaccination or not was rested entirely on the different ways of interpretation of aphorism 46 and its footnote in 6th edition of Organon. Here, I would like to draw your attention of the interview of Dr. Peter Fischer and Dr. Rudy Vesper on the subject. The comprehensive research on the exact position of Hahnemann on vaccination has been lacking and happens to be the main reason for controversies and different schools of thought among the homeopaths on the subject. Here we have tried to comprehensively study the Hahnemannian literature and to draw a roadmap and develop a clear consensus on vaccination. What we have done, a comprehensive literature search was done, including Hahnemann's major works such as Organon, the chronic disease, Materia Medica Pura, and other literature such as lesser writings, redacted writings, letters, biographies, and miscellaneous publication. Now, building or creating anything of value requires a solid foundation. In the time of COVID pandemic, the need for developing a clear and well-founded consensus on vaccination has emerged more strongly than ever in the homeopathic community. In this process, the first thing that is required is a comprehensive understanding of Hahnemann's position on vaccination. The only semantic study of Organon will always bring multiple interpretation and controversies unless they are read in connection with other Hahnemannian literatures, including books, letters, articles, and case records. After extensive research of Hahnemannian literature, we found that there is no scope of any ambiguity regarding Hahnemann's position on vaccination. Ever since the discovery of vaccination by Jenner, Hahnemann had praised and supported the idea of vaccination and its excellent value in reducing the severity and scale of he considered vaccination as one of the most fortunate discovery for mankind and was strongly against criticism of vaccination. It is further interesting to note that he maintained his positive viewpoint for vaccination till the end, which can be easily seen in the last edition of Organon as well. The salient features of his observation is summarized as follows. Before discussing his observation, which has not been in the ambit of discussion so far, we could trace these following 7 observations of Hahnemann in different literatures, letters, and writings. To start with, we could see the first is the Medicine of Experience in 1805, then in 1808, this Hahnemann's lesser writing in a work called On the Great Necessity of Regeneration of Medicine, which is an extract from a letter to physician of high standing. Then we also could trace his observation in a letter to von Jesdorf on 26 August 1825. And in the same year, we also could find a correspondence with Dr. Staff on 22nd December 1825. This both of the letter were written in the same year. Then we could also see some one observation in the chronic disease, the peculiar nature and their homeopathic cure. And thereafter, we also got one letter which was addressed to Dr. Scrater on December 1931, published in Staff Archive. And lastly, in 1842, the 6th edition, aphorism footnote to aphorism 46 and 56. The most important observation I'm going to discuss as per the flow of the idea instead of as per evolution. So the first most important observation that we could lay our hands on was in the year 1808 from a letter to a physician of high standing. Here he says, vaccination is most fortunate discovery and is according to similia principle. In fact, one of the earliest and unequivocal stand of Hahnemann on vaccination can be seen in the year 1808 in a footnote to this letter addressed to Hoofland. Here he mentioned distinctly that vaccination is the most fortunate discovery and is among the 3 or 4 positive discoveries in medicine ever since the time of Hippocrates. He further goes on to state that like all other real cures, vaccination is also according to his principle of similia. He says, quote, to these must be added that most fortunate discovery, the protection from variola by means of vaccination. And these 3 or 4 cure takes place only according to my principle similia similibus. Nothing more of a positive character can be exhibited in the whole medical art since the time of Hippocrates. The cure of all other disease remained unknown, quote unquote. Second important observation that we found was in a letter to staff in year 1825. Here he observed that criticism of vaccination and homeopathy is not justified as it has proved to be efficacious. In fact, it is fascinating to know that in early phase of vaccination, when severe criticism was profusely written against even by the allopathic guilds for the vaccination, Hahnemann had supported vaccination wholeheartedly. In his letter to staff in 1825, Hahnemann compares the criticism and hostility against homeopathy as similar to that of vaccination. He further mentions that though both are proven to be efficacious, but are criticized simply for the reason.
Excuse me, Dr. Tiwari, can you please sum it up because your time has been over?
Okay. So just I would like to conclude. So
yeah, please.
in all these 7 letters, we find that there is no doubt that Henneman was strongly in favor of vaccination. In contrary to the most prevalent notion in the profession, our study found that Henneman was not only a strong supporter of vaccination, but rather a strong critic of those who wrote against vaccination. Henneman has supported the idea of vaccination and its excellent value in reducing the severity and scale of smallpox epidemics on multiple occasions. He considered vaccination to be the most fortunate discovery and is among the 3 or 4 most positive for the adverse effects of vaccination. Instead, with sulfur to minimize the adverse effect in sensitive children. Thank you. I'm ready to take any question if there are.
Thank you, Dr. Himanshu. I think you made very clear that we should not quote Hahnemann to criticize vaccinations.
Yes, sir. Absolutely. We should not do the blanket criticism.
Thank you, Dr. Himanshu. So now we have a speaker from Spain, Dr. Antonio. I think he has cancelled. Now the another one is from Mexico, Dr. Edgar Fernando Cortez Martinez, and his topic is Oxygenum una propesta pro filiaci y therapeutica. It's a Mexico word. So I think we have the translator in this session also. And I would request, it is a prevention kind of study, and I would request Dr. Edgar to share the screen and give his presentation. Dr. Edgar, please. Yeah, he had already shared the screen.
Dr. Edgar, can you start your presentation?
Yes, it's visible.
Yes, it is visible. Yeah, can you please a little zoom in? Yes, little more. Yes, perfect.
Yes, it's fine. Okay. Please be start.
Buenas tardes, soy el doctor Fernando Cortés desde la Ciudad de México. La presente investigación trata acerca de un estudio que se realizó en personas que todavía no habían sido vacunadas en el periodo de mayo del 2020 a mayo del 2021, circunscritas a la Ciudad de México. El título de esta investigación se llama COVID-ARS, nosode post-COVID-19, una propuesta profiláctica y terapéutica para SARS-CoV-2 y sus fundamentos a través de electromagnetometría cuántica de ruido térmico. Introducción. Desde que inició la diseminación del nuevo coronavirus, se han buscado soluciones que permitan conferir protección a los diferentes grupos poblacionales y a pacientes infectados en esta pandemia. Ante esta necesidad, se creó un nosode obtenido de una paciente convaleciente que se encontraba bajo tratamiento de Arsenicum album. Los objetivos: brindar protección a los diferentes grupos poblacionales con mínimos efectos adversos. Esto se consigue a través de una dilución de 1/14 con agua destilada, precisamente lo que se conoce como método plus, para dar menos efectos adversos a los pacientes y mayores efectos terapéuticos. El segundo objetivo es evidenciar con un monitoreo asequible la efectividad del medicamento utilizando oximetría de pulso para constatar su acción profiláctica y terapéutica. Es decir, tenemos parámetros cuantitativos. 3. Caracterizar las diferentes diluciones y demostrar sus propiedades electromagnéticas para evidenciar las frecuencias involucradas que crean la enfermedad hipóxica artificial y transitoria en los pacientes. Con esto tenemos el mecanismo de acción de nuestra sustancia. Nuestro estudio fue un estudio piloto en 114 pacientes que fueron divididos en 3 grupos: positivos, sospechosos y sanos. Los positivos se consideraron aquellos pacientes que tenían PCR positiva y tomografía para SARS-CoV-2. Los sospechosos se dividieron en 2 subgrupos: en sintomáticos, aquellos que presentaban 2 o más signos y síntomas de la primera y la segunda ola, entre los que destacan la pérdida del olfato, la pérdida del gusto, la disnea y la temperatura. Los asintomáticos fueron aquellos pacientes considerados con hipoxemia silente, con niveles de oxigenación menor o iguales a 94, y como criterios de exclusión se consideraron aquellos pacientes que tenían anemia y patología pulmonar previa. Para nuestros pacientes sanos, se tomó en cuenta su nivel de oxigenación que sea mayor o igual a 95 y se excluyeron aquellos pacientes también con anemia o con ingesta de medicamentos como metilprednisolona y ibuprofeno. Nuestra investigación realizó el análisis de la sustancia que se suministró a los pacientes basados en el dispositivo de captura de señales electromagnéticas de Luc Montagnier, donde tenemos 3 segmentos. En esta parte tenemos la sustancia, la amplificación del ruido térmico de la sustancia y también tenemos el análisis computacional de los datos. Para nosotros poder comparar los medicamentos que fueron administrados a nuestros pacientes, utilizamos este modelo matemático basado en la similaridad del coseno, que denominamos índice de similaridad electromagnética, con la cual nosotros podemos comparar una sustancia de otra y ver qué tan similar es a la otra. En cuanto a los resultados, una vez que se administró el tratamiento, previamente se había medido el nivel de oxigenación, poniendo en el punto 0, y después se reportaron consecutivamente los cambios que se produjeron después de la administración del medicamento. En el total de la muestra, nuestros pacientes se comportaron con un mayor predominio de 0 a 20 unidades en los cambios del nivel de oxigenación, que se tomó como un incremento, y hay pocos pacientes o menos pacientes que tuvieron un decremento en el nivel de la oxigenación. Esto se debe a que también había aquí pacientes sospechosos que pudieran haber estado contagiados de COVID. En el análisis por definición operacional, nosotros dividimos en pacientes sanos, sospechosos y positivos. Si ustedes notan los cambios que hay hacia la derecha en relación al nivel de oxigenación, pueden darse cuenta que en los positivos, en los sanos, estos cambios son mayores que con respecto a los negativos. En cuanto a los sospechosos, vemos un cambio más significante. Esto también se debe a que las potencias usadas para este grupo poblacional fueron las más efectivas, entre la 30 y la 200, y vean que hay menores cambios hacia la izquierda. En cuanto a los positivos, hay un claro predominio de cambios hacia el nivel de oxigenación, porque se utilizaron potencias más efectivas como la 200 centesimal. En cuanto a la distribución por cuartiles del nivel de la oxigenación, las potencias sexta y la potencia 18 quedan descartadas porque su efecto terapéutico es bajo o negativo, lo que se considera que no fueron óptimas para este proceso. En cuanto a las propiedades acústicas del medicamento, en base al índice de similaridad, las sustancias preparadas en método Plus tuvieran en la 30 centesimal un índice de similaridad en el orden de las 10 milésimas, con muy ligeras variaciones, y para la 200 centesimal una similaridad en el orden de las milésimas muy bajo, lo que quiere decir que nuestra sustancia bajo esta fórmula tiene una alta similaridad, lo que casi es igual a 1. En cuanto a las conclusiones, el COVID-ARS es capaz de conferir protección profiláctica y terapéutica en sus potencias 30 y 200 a todos los diferentes grupos poblacionales. Existe un incremento significativo, mayor fuerza medicamentosa demostrado por la técnica electromagnetométrica cuántica de ruido térmico entre la potencia 30 y 200. Y también el fenómeno de conservación de la energía queda demostrado en el método Plus. 3. Las replicaciones más efectivas fueron la 30 y la 200 en método Plus, y en relación a la replicación de las sustancias o la clonación de las sustancias a través de audio con solenoide, las más efectivas fueron aquellas realizadas con un campo electromagnético, ya que el índice de similaridad electromagnética fue mayor. Este es en sí todo el trabajo y le doy las gracias por escuchar.
Thank you, Dr. Edgar. And I would like to apprise our chair to judge this poster by the results and by the poster itself, because somehow the translator is not available at this moment. So if you sorry for the inconvenience, and if you could want to see the poster, Dr. Edgar, you can enlarge your poster so that our chair can go through again for the judgment. So shall we go with if any questions, or shall I go ahead?
I think in question there is a language problem.
Yeah. So we'll
So
invite our next speaker.
yeah,
It's Dr. Vaishali DM, and it's a treatment prevention kind of study. The title of the study
yes.
is Hahnemann's Supreme Research Design COVID Scenario. So I would request Dr. Vaishali, and I request Dr. Edgar to leave the screen, please, so that our next speaker can join. Conclude our session. So Dr. Manchanda is with us. I would request to sir, please say a few words about the session, and kindly invite the Toad over is also in this session. So you can conclude the session, please. Dr. Manchanda.
First, chair is there, so let Lex give his comments first. I think so.
Yes, yes, sir. I think first chair, then sir finish.
I think Dr. Manchanda can do that as well. So, okay. Well, my general impression about these presentations is that we need more communications. So we saw rarely used medicines that could be useful in sinus tachycardia. We saw a rarely used medicine for alopecia, and well, we just need more cases about this because we cannot go on one person that has some experience with one medicine, and we should exchange these experiences, especially these quite rare experiences. Well, it was nevertheless an interesting experience, and I was especially pleased by the conclusion that Hahnemann did not reject the vaccinations. I think that should be stressed, that we as a homeopathic community should not go into that discussion. Thank you.
Thank you, Lex. First of all, we are grateful to you that you have spent so much time with us today. And I will not say it is evaluation of posters that say, but it is to give comments and encourage all our researchers to work more. And we are often talking about this, that in India and in many parts of the world, a lot of clinical data is generated. What is most important thing is how to project it and how to collect it. So on this issue, we are going to have a big round of discussion also during LMHI colloquium. So I invite all the authors of this group that are presenting different case reports, different case series, that they must attend this group discussion, one of the panel where Lex is going to chair, and I will also be with him, and with several panelists. We'll be discussing that how to report these results and how to critically evaluate these results, so that everyone should be able to get good results in their practice. So with these words, thank you very much for joining this. And many audience are there. So I just came to know from the portal that thousands of people are listening to all the 3 sessions of posters. So I'm hopeful that even for our main program, many people are going to join. Just for information of all of you, that so far we have crossed about 3,700 and so many registrations for this colloquium. So thank you very much for
Thank you, sir. Congratulations to the team also, sir.
Yes.
Sir, very congratulations, sir, for achieving such good target in such a less time, sir.
So I would like to thank you, our chairs, Dr. Manchanda, Dr. Bineet, and all our entire team, who all are panelists and speakers and attendees. Thank you so much for having us, and it was a wonderful session. All the post-COVID experiences, everything has been presented very well. So once again, I thanks everybody. and we will shift to the another session. And I invite to join all the 3 days to join this marathon till 12th December. So you
Thank
will
you
be
for
able
this
to.
wonderful organization.
Thank you.
Thank you, sir. Thank you.
Thank you, sir. Thank you, sir.
Okay.
Okay. Somebody is sharing her poster.
Yes, I'll be doing that.
Okay, okay. Because I also received the poster. If somebody is sharing, then
Can you
okay.
see my screen?
Yes, 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 yes. You
Perfect.
need to
Just
zoom in. You need to zoom in.
how to do that? Can you help me with it?
On the left side, there is a sign. See my cursor? I'm
Yeah, yeah, yeah.
circling.
Perfect. Perfect. Got it.
Yes, yes, correct. One more click, please.
Okay.
Break of the middle, you understand. Patient will not tell that it is a break of the middle.
Can I begin?
Yes, but it is very. If you could zoom in more, because it is very low, less. One more click, please. One more.
Okay.
On that plus sign only.
Okay. So can I begin?
Yes, you
Okay.
can go ahead. Although
Thank
it
you.
is not proper visible, but it's
Okay.
very less font size actually. It is okay. You can explain your.
All right. All right. Okay. I'm Dr. Vaishali, and my poster today is Hahnemann's Supreme Research Design. So Hahnemann's research design methodology broadly has three phases. Phase one, keeping almost all factors constant in the subjects. Here we are talking about the provers. Phase two, introducing one drug, testing substance, letting it unfold its pathogenesis, and allowing the influence of various factors on the pathogenesis. So here we are mentioning the modalities. And phase three is the clinical verification of the data collected from phase two. This design enables us to give tailor-made, high precision, high efficacy treatment in diseases, including COVID. The rationale, the disease is life-threatening. So every life is precious. One life saved makes a huge difference for the family. Various research methodologies are in way. One would like to see and prove the efficacy of a method that is time-tested. In this study, there is no control group, as every individual is a control in themselves and also considering the above factors. So this pandemic gives us an opportunity to verify the efficacy of Hahnemann's research methodology as against conventional design. The inclusion criteria over here is the clinical symptoms for more than 3 days. And this data giving definite complete symptom or characteristic symptom as defined by Boning-Hassan. Investigations like RT-PCR being positive and oxygen saturation above 80. What I mean or understand by complete symptom is those complaints of a patient that has exact location with or without extension, radiation and alternation, sensation or complaint, most probable emotional or physical cause, aggravating or ameliorating factors, and concomitants. It could be physical or emotional. So the repertories used over here are Boger-Boning-Hassan's characteristics and repertory and NER repertory of Herring guiding symptoms. The indicated single remedy was given in 30 potency, 5 pills, 100 ml aqua, 8 drops rectified spirit in 120 ml amber bottle. The patient is asked to shake the medicinal bottle well, to drink 6 ml per dose, once at 8 a.m., 12 noon, 4 p.m., 8 p.m. daily till completion. 30 minutes interval for food or beverage before or after the dose. The sick individuals are allowed to be in their natural settings and advised to refrain from using any substances that has known medical action. The follow-up criteria which was considered was review or follow within every 24 hours, after 3 days, after 15 days, and after 30 days. The symptom relief should follow one of the Herring's criteria of direction of cure, within out, most important to least important organ, above down, reverse order of symptom disappearance, RT-PCR negative with third day, and RT-PCR remaining negative given on the 30th day, and oxygen saturation improving above 95. So the result, what is seen is the commencement of curative reaction was observed from 1 hour to 24 hours. That's on an average of 6 hours, the patient started improving. Completion of curative reaction was seen between 3rd day to 15th day. Response to one remedy itself was observed in about 30 subjects, and need of change of remedy was seen in 2 subjects. RT-PCR negative was seen on 3rd day in all the subjects, negative on 30th day in all the subjects without any other additional organ or systemic disease progress. Saturation improved above 95 from day 1 to 3rd day, and there was no oxygen support needed. There were no casualties seen. There was no food, beverage, drug, environmental allergies with homeopathic medicine. The reason for the result percentage I would attribute is for the inclusion criteria, the types of totalities. The remedy prescribed was tailor-made. The modalities helped in selection of remedy. Generalities helped in designing diet regimen, do's and don'ts for every individual. It is also observed that not changing anything else in patient's living condition has twofold advantages. It is easy for patients to remain as they are, and the homeopath is more sure that the result is due to the medicine given. So the take-home message or my conclusion here is, Hahnemann's research model is an ideal, quantitative, qualitative design for widespread application in healthcare, especially in vivo studies. Cases that followed at least one of Herring's cure guidelines is considered as drug-induced remission and not spontaneous remission. Hahnemann's provings incorporating individual variants reign supreme as the end beneficiaries are subject to permutations and combinations. Thank you. That's my poster presentation.
Can I stop the screen share now?
Yes.
Thank you, Dr. Vaishali. It's good to see that Hahnemann's remarks are still valid, but one thing he could not foresee is information technology. I think with big data, we can now also turn to the more common symptoms that we can analyze more precise, and also, of course, the precise and the peculiar symptoms remain most important, but we have more possibilities now. So can we conclude the session now?
Yes, I think this is the last speaker. Now we can conclude this session.
Okay. Well, thanks to the organizers. Very well done. And hope to see you in the next days.